Tell me about your symptoms before the surgery, which was about 10 months ago, right?
Yeah.
It was in January, 10 months ago. So tell me about your symptoms.
So my main symptoms would have been because of my spondylolisthesis or whatever, and that vertebrae moving so much. When I'd sleep at night, when I'd get up in the morning, I'd wake up and it would probably take an hour of moving around and walking hunched over in the pain before I got enough blood flowing through to where I would feel
So
fine.
you had lots of back pain.
A lot of back pain.
When the back pain was bad, how bad was it, 1 to 10?
Oh, I would say in the mornings, in a normal morning, it would be like a 6, and then throughout the day, then once the blood got flowing, then it would just get better and better and better.
Yeah, and what I need to mention as well for people who are listening to that, you are a farmer.
Yep.
Usually 6 for a farmer is a 10 for normal people. So because farmers are just tough, they just always, that's my experience, they always underreport their pain and comparing to other people. So 6 is a serious pain for you every day. Now, what about the leg pain? Did you have any symptoms in the leg?
My legs actually weren't too bad. The last year or two, I kind of thought maybe I had restless leg.
Yeah.
When I would sit in the evenings, then I thought maybe I had restless leg. But...
Most of the symptom was in your back.
Yeah.
And we did obviously physical therapy and all the other treatment and so on, and you weren't getting better, so we decided to do the surgery. Do you remember the surgery?
Yeah.
So your surgery was, this is what you had. You had what we call grade 2 spondylolisthesis in the L4-5, and as well some significant disc disease in the levels above. And we did a 3-level fusion, and this is the result of the surgery. And this surgery, I have the record of the surgery, was, you stayed only 1 night in the hospital. The surgery was 1 hour and 24 minutes, and we lost only 82 cc, a little, actually 2.5 ounces of blood. That's all what we lost. Now, when did you leave the hospital? How long did you stay in the hospital with the 3-level fusion?
So after surgery, it was less than 24 hours later, I walked out with my walker, of course, then hopped in the car and we headed home.
When did you start doing basic daily activities after the surgery?
After surgery, I suppose
Probably.
month and a half, I suppose.
Yeah. Is that when you start working again and doing things in the farm?
Yeah, I started doing light duties.
Yeah. Now, how bad is your back pain now?
So my back pain, when I wake up in the morning, I don't notice really any back pain whatsoever. It's just if I overdo it from lack of exercise or whatever now, because I've been waiting for that to heal. Because I can tell when
Because I asked you for a year not to do a usual farmer abuse.
Right.
Right?
Right.
Okay. Now, this is your picture. Bone is growing. Bone is beautifully growing and everything is where it's supposed to be. And literally, here you see the bridging bone, even in L5S1, where you had your grade 2 spondylolisthesis. We did this surgery with a minimal invasive fashion, with small incision, and that's why my patient always recover faster. But you asked me about what you can do and what you cannot do. So maybe you want to ask your question about, one more time, and I can answer it so people as well in your situation can understand what that really means. What was your question regarding the activity?
Well, so I was wondering, as far as activities go, I was just wondering how far that I could go to, because as a farmer, we do things probably more than we should be. And I wanted to know where the fusion took place compared to my vertebrae above that. Are they as strong as the ones above it? Am I... so I don't injure something.
So now, actually, you asked the question, can I do everything I want to do? And my answer to that was, well, I don't know what everything is. Like if you want to jump off the building, I cannot tell you it's an okay thing to do. But for all practical purpose, bone is growing. In those segments, you're stronger than before because not only the bone is growing, but as well you have metal. If damage is done, it's usually done to other levels. Having said that, even though from the surgical standpoint, you don't have any limitation, you have the natural and common sense limitation that somebody in your age group has. And And I really like that she was saying that you can do everything that a 50-year-old person can do. Probably not everything that a 20-year-old person can do.
Right.
I think the best way as well of doing thing is whatever you're doing, add few notches, go a little more, and then watch yourself for a few days. Find out what your body tells you.
Right.
And that is, I think, the best way to be better and do more without causing any additional problems.
And I kind of been doing that all along here. My wife is usually the one that, should you be doing that? And I'm just like, well, it's more therapy. It's more therapy.
To a point. If you notice that your body tells you not to do something, you already know not to do it. But again, at this point, since the bone is growing, all your limitation are limitation based on your age group. Because some of my patients truly believe that after the surgery they can go and, if they are 50, they can go and be 20. If they are 70, they can go and be 40 again.
Yeah.
Unfortunately, nature has put some limitation there that none of us can overcome. But as long as you slowly add to the activities and then go up, you should be all right. Okay.
Okay.
Now, before the surgery, did you do some research about the option for the surgery and what options are there for the surgery?
Yeah, we did.
Research?
We did. Went to a couple different doctors or whatever, and
You
I
don't have to
wasn't
tell
real.
me the names, but what did they tell you? What made you choose us?
Well, I wasn't real crazy about having them cut me wide open and basically laying my insides on the operating table to put me together. And then when I come here and you guys were going to do the less invasive, and rather than like a 6-7 hour surgery, just an hour surgery.
Yeah, 1.5 hour. In your case, it was 1 hour and 24 minutes.
Yeah, and as far as the healing up,
Recovery time.
the recovery time, I knew that once they cut muscle, that was going to take forever. And being a farmer, and we got a lot of livestock, I had to be able to get back on the job.
Yeah, you told me about 1.5 months after the surgery, you went back to start working. That would have been unimaginable after open old-fashioned surgery with your kind of job.
Yeah.
Maybe with a desk job, but unimaginable for your kind of job because, again, as you said, cutting those muscles, all that additional 7 hours that we would have spent in open surgery is to cut the muscle, literally with electricity, cook the muscle to stop the bleeding, and your body just recovers much different from that kind of surgery.
I would say we were both very happy with the surgery.
Oh yeah.
Yeah, and and in your case as well, you didn't have a small little problem. You had a grade 2 spondylolisthesis. Your bone was literally falling apart, and this was by any standard, it was a very big surgery.
Yeah.
Still, we did it in a short period of time. Still, in less than a day, you went home. But compare, only people who have done or have seen the old-fashioned surgery can truly appreciate how much faster the recovery is. And have you had a chance to talk to anybody who had the open surgery and so on? Or did they explain to you, did the surgeon explain to you how the steps are, recovery and so on after the open surgery? Did they explain it to you?
What we did learn was it was just going to be a long time. I mean, it was going to be, it was a process that it was going to be take too long. That's why Scott put it off for so long, because
that's why I put it off for so many years.
Yeah.
Because it was going to take so darn long, and I didn't feel like I could take that long.
Yeah.
Suffer with the pain.
Well, so far, do you think we have delivered what we talked about?
Yeah.
Yes.
If I was to, if you're asking if I'm
Yeah,
satisfied with it,
right.
I would do it in a heartbeat, right?
Yeah.
I
No.
wouldn't live with the pain.
Thank you. Well, I'm hoping after this you don't really need my skills anymore. So in that sense, I hope I never see you again.
Yeah, I hope I don't have to see you
Seeing me is
again.
not a good thing, but we talked about that there are some other things I did not make you younger. You still may have some problem in the upper level as well. Almost half of the people, 43% of the people after a spine fusion have sacroiliac joint problem. And you do have, you said 1 of 10 pains, sometimes with certain activity in that area. But by you keeping your muscles strong in that area, not overdoing it and slowly adding, I'm hoping that overall everything goes the right direction. And then I never see you again then.
Yeah.
Okay?
That sounds
Good.
good.
Okay, well, thank you so
you.
much for the
Great.
interview. I appreciate it.